Well, good morning, everyone. I'd like to welcome you to the Public Health and Human Services Board today, Tuesday, July 18th. And the first thing we'll do is approve our consent agenda items. Are there any items a commissioner wishes to pull?
Madam Chair, I would like to pull item C, the financial report, please.
All right, thank you, Commissioner Hawkins. Any other items that should be pulled for discussion? All right, if not, is there a motion to approve the consent agenda without item C?
I'd move.
Thank you, Pat. Is there support?
Support.
Thank you, Commissioner Hawkins. We have a motion and support. Any further discussion? All in favor? Aye. Opposed? Motion carries. All right, let's take a moment to talk about the financial report. And Commissioner Hawkins, do you have questions or comments?
Yes, I want to thank Allison for yesterday. I asked a couple of questions, but I would like some more clarification. So we had a couple of line items on our report that are over budget, and we're only halfway through the year. And I get there are unexpected expenses that happen, and especially when we have to have out-of-county placements. I'm wondering, is there reimbursement from the state for any of those services?
Yes, thank you for your question, Commissioner Hawkins. So just referencing the email that you sent yesterday, your questions were in regard to some children and family services line items, as well as mental health services. In the case of the children and family services line items, I'll just reiterate for the benefit of the rest of the board and the public where those overages were and the reason for that. So the financial report included in the agenda shows that children and family services is at 123% of budgeted expenses. This is largely due to increased expenditures across two program areas, those being FARS, or the Family Response Program, and PSOP, the Parent Support Outreach Program. Again, both were over budget. For year to date, Grace and I had a conversation about do we expect that to continue through year end, and she was able to give some information based on families that we're currently working with, providing some of these more preventative services to. PSOP and FARS are both more early intervention services. Both receive reimbursement or receive an annual allocation from the Department of Human Services to provide these services. So yes, there is reimbursement in those children and family services area. And as I stated in my email to you, Commissioner Hawkins, we don't expect those to increase at the same rate through year end based on the trajectory of some of our work with these families. But again, these are very hard to project based on needs emerging in the community. Your other question was in regards to mental health services. We are at 101% of budget for year to date in that area. That increase is due to an adult mental health placement in a state-operated facility. Again, these are court-ordered expenses, very difficult to anticipate when needs like this might arise. In some cases, there's reimbursement for those services. I don't know that I can provide the specifics of this individual case. But these are not solely county levy dollars in both of these program areas.
They are not? Or?
They are not solely county levy dollars. So in particular, in the children and family services area, we receive a state allocation to provide those services.
Okay. And the state hospital, I was just kind of shocked at the amount. Is that for more than 1 month? Or it just showed up in this month, but it really has been more months? What does it cost to be at the state hospital?
It can be very costly.
Mm-hmm.
That just blows me away, that amount of money.
Mm-hmm.
And there is no state reimbursement for that.
Depending on the circumstances, there may or may not be state reimbursement.
Wow. Mm-hmm. I guess that's something we need to discuss with our state legislature, yes. Thank you. I just wanted more clarification about those line items.
Thank you for your questions.
All right, thank you so much. All right, at this point, we'll move on in our agenda to item 3, and we'll turn it over to Allison.
Commissioner Sullivan, did you want to take action to approve the financial report? As that was pulled from the consent
Absolutely,
agenda.
since we did. Thank you for reminding me of that. So is there a motion to approve the financial report as presented? Thank you, Rana. Second?
Support.
Thank you so much, Commissioner Storlie. So we have a motion and a second. Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries. All right, now on to welcoming our new staff.
Great. So we are very thrilled to be welcoming Lily Carlson to the Public Health and Human Services team. Lily joined us last month on the 20th. Recent grad of social work school, and she's just jumping in and learning a lot, connecting with families, set up to do her Department of Human Services Foundations cohort training next week. We're thrilled to have her on board. This position's been vacant for nearly a year, so we're finally fully staffed on our Children and Family Services team. So I'll let Lily and Grace introduce or say more if you'd like.
Good morning. Thank you. Yes, it's true. We're so happy to have Lily here. And with Lily's hire, we've rehired and we've reconstituted our entire team. And so that'll be very beneficial to everybody. And one of the really nice things about the family services position is the state has a very specific training process, and it is very, a lot of the things that we have to do are very prescriptive. They're in statute, and so that really helps structure things. And so they have very nice training. They have the University of Minnesota and the Department of Human Services have what's called the Child Welfare Training Academy. And so what Allison was referring to is next week Lily will be attending the first cohort group. So she'll be meeting with perhaps 20 other people who are going through the same process as her, learning how to work with families. And so we're just really excited. I'll let you say a few things about yourself, Lily, not to put you too much on the spot.
Sure, thank you. Yes, I'm very excited for this training starting next week. I think it'll be great to get that foundation starting off here. Yeah, it's been great. I think this is my 4th week now, and I've enjoyed getting to know everybody and getting to know families in the community. So.
Welcome. We're so happy to have you.
Thank you.
All right. Questions or comments? Commissioner Hawkins.
I'm always curious, where did you come from and what's your background? What job did you do before this?
Sure, yes. So I'm from Southeast Minnesota originally, and I went to Luther College, so I'm a recent grad from there, where I studied psychology. And yeah, so this is my first position out of college, which is very exciting, and I'm so excited to learn and grow in this area.
I think one of the things that impressed us with Lily's resume is during COVID, when a lot of people were wondering what to do, Lily decided to become an EMT. And so she, really served her community in that way, and it's really brave and important work, and so it's just very impressive. I have to say, Lily's minor is in music, and you will be seeing her on stage in the next couple of weeks.
Yay.
She's really jumped in that way, too. So just really involved in the community in a lot of different levels already.
Well, I'm sure we'll appreciate your many talents and skills. Well, thank you so much, and again, a welcome from the entire community. We appreciate what you do.
Thank you so much.
All right. On to our director's report.
Great. Thank you, Lily and Grace, for being here this morning. Start, as always, with staff updates. A lot to share this morning. Again, Lily is here, which is fantastic. We are also very excited to have Plamen Dimitrov moving into the Fiscal Supervisor role effective with today's consent agenda. Plamen's been with us for the last 5 years as a fiscal officer with the Public Health and Human Services Department, so brings just an excellent foundation of knowledge in the very complex and varied funding sources, billing mechanisms, grants that support our work as a department. We will be posting the fiscal officer vacancy this week to backfill Plamen's position. Again, the shuffle of internal promotions leads to another vacancy, but confident that we'll be able to find someone to fill that position. Plamen laid a really strong foundation for that role. That was a brand new position. Lori Erickson actually was in that briefly before she moved into the fiscal supervisor role. Over the last 5 years, Plamen has done great work to really formalize a lot of processes and procedures, especially in the estate recovery area, where we're really lacking in past years in terms of our collections on estates when a medical assistance enrollee passes away and meets the certain criteria for estate recovery. So Plamen did great work with the state to develop that program, so confident that we'll be able to have someone come in with that strong foundation. We will also be posting this week to backfill the Children and Family Services Supervisor position. Also on the consent agenda this morning, you recognized Grace Bushard's retirement after 16 years of service to the county and children and families in Cook County. So grateful that we'll have a period of time in which to recruit for that position and have as much overlap as possible so that someone can mentor with Grace, learn about the rules and programs and statutes that govern our work in children and family services. Finally, we're continuing to recruit for several other positions on our behavioral health team, including the coordinated crisis response worker and the adult mental health case management position. Offer was accepted and approved at last week's regular board meeting for children's mental health. So excited to have Marissa Chapman coming on board in August, contingent on housing as always. I did include an updated org chart in the agenda materials, but unless there are questions, I'll move on to our department updates. All right, so July has been a very busy month for us in terms of our community engagement work. Our public health team partnered with Kids Count on Us and Cook County Higher Education for an event with local legislators to bring light to the child care crisis and some of our local efforts to support providers and families. You'll hear a lot more about this at the Committee of the Whole meeting later this morning. Last Thursday, our public health team hosted the Community Health Improvement Plan meeting at the Community Center with the option to connect on Zoom. Several of you were in attendance there. We had about 15 people in person and another 15 online, but we also heard from quite a few people who weren't able to attend and wanted to be there. So we are working to find ways to continue to receive input on those priority health areas, and we'll be sending out a survey to some key stakeholder groups.
Can I ask Commissioner Hawkins?
I was one of those that was not able to attend that day. Was that recorded at all?
It was.
Oh, good. I haven't looked yet, but can you send me a link to that?
Absolutely. Yep. I'm
Thank
just
you.
in the process of uploading it now. We also have the recording of the June Community Health Assessment meeting. So both of those will eventually be available on our website.
Thank you.
Absolutely. Our Public Health Fund Review Subcommittee met twice in July thus far to review proposals for 2024 funds to support local nonprofits whose mission aligns with our Community Health Assessment and Improvement Plan. This year, we're always improving and changing that process, so new this year was a virtual Q&A session with prospective applicants. The group met last Friday and drafted some initial recommendations with different scenarios based on whether or not the board would approve ongoing funding to the child care providers through those wage stabilization grants. We received an age-friendly communities grant from the Department of Human Services. This will be a collaborative effort between Public Health and Human Services and care partners to better understand the needs and experiences of older adults in Cook County, as well as the steps that we can take collectively to become an age-friendly community. We also received notification last week that our grant application to the Department of Human Services to procure a mobility accessible vehicle was approved.
Yay.
So this will involve purchasing a vehicle with a lift. This is a pretty significant gap in our local transportation services. This would be shared with other agencies, primarily care partners, our in-home support program, and the care center to meet, again, that significant gap for older adults with mobility needs. This was a modification of a Live Well at Home grant that we had submitted in 2021 and were not successful. And we're just starting the process into entering contract negotiations with the Department of Human Services. So the work is just beginning in earnest to address questions around liability, risk, insurance, etc. We will utilize an existing pool of trained and vetted providers through the in-home support program and care partners, but one of the goals of this project is also to increase recruitment for drivers locally. This is modeled after vehicle sharing programs in other communities. Martina Johnson, who is our adult and home and community-based services supervisor, is the project manager on this grant, and she's been engaged in some regional initiatives through ARDC, including the Regional Transportation Coordinating Council, so is learning more about other communities and how they've addressed these needs through vehicle sharing programs. Again, one of the other goals will be to convene a local transportation coalition with providers throughout the community, Grand Portage Human Services, Grand Portage Elder Nutrition, North Shore Healthcare Foundation, North Shore Health, in-home support care partners, and others who are working to fill transportation gaps locally. And again, also written into the grant is the work that will be necessary to establish insurance, contracts, memorandums of agreements, and all of those policies and procedures to reduce risk for the program. Finally, we will be presenting a preliminary budget for 2024 at our next Public Health and Human Services Board meeting in August. So thank you for your flexibility in allowing an additional month to pull that information together to ensure that we have more up-to-date rate and revenue information from the state, and a fiscal supervisor in position to partner with me on that presentation.
It helps, doesn't it?
It does. Also, alongside that presentation of our budget, I hope to share more information and a year-end summary of the 2023 legislative session and some of the significant investments in health and human services at a state level and what we know about how that will be implemented locally. One of the big changes approved in the most recent legislative session was the reorganization of the Department of Human Services into 3 separate entities: the Department of Children, Youth, and Families, and Direct Care and Treatment, so the administration of those state-operated facilities. Happy to take any questions on my report.
I think the reorganization is going to be beneficial.
It's hard to say. It sounds like there are a lot of benefits to having more separation. It's all in the implementation, of course. Sure. It sounds like the department is committed to working with counties, tribes, service providers to engage them along the way. So I'm reassured by that.
Cool.
Yeah.
Any other questions or comments? I'm just very excited about the change in transportation and
Amen.
making it more available for those people in need. So that's great news.
We'll have a lot more to share as we enter into contract agreements and start formalizing some of that work.
Absolutely. All right. Well, thank you.
Thank you.
Well, we have no items listed under 5 for board action, so we'll move on to our committee reports this morning. And we'll start with Commissioner White, the Active Living Steering Committee.
Oh, well, they have been busily raising money. They have, and this is a request that I think is important. They have a medical lending stash. It's very small, but if somebody is in need of a wheelchair or a walker, temporarily, it can be borrowed. It's like check it out from the library. And so if you have one in your back closet or in the garage and you don't need it anymore, please donate it. It goes to a good cause, and that's the one big thing. And so Fisherman's Picnic's coming up. Any chance you get to more pancakes, no, actually not more pancakes, but they're going to be having fundraisers for jewels and purses. and they're going to be selling them. So donate your old jewels and your old purses. It's a new one to me, but they couldn't find anyone to do the tools.
I was
I mean,
gonna ask.
tools rhymes with jewels, but they couldn't find anyone who really had the expertise and/or time to assess the donation of
Oh,
tools.
that's
So it's
too bad.
purses.
That looked cool.
Yeah, so, that, I think I did most of it last week about the Council on Aging, so.
Okay.
Yeah.
All right, great. Well, thank you. Arrowhead Economic Opportunity Agency, AEOA. I don't have anything from Commissioner Mills. Commissioner Storlie, did you happen to attend? Well, he was gone. All right. Well, thank you. Arrowhead Regional Corrections, Commissioner Hawkins.
Yeah, last month, we had our meeting, and I just wanted to report that NERC is working on getting Northland Community and Technical College, that the men can take classes there in the trades. So that is working on, I'll know, we have another meeting on Friday, you know, if that has actually happened. But I thought that was exciting to know that we're getting those trades into the programming. They've been working on this for a while. And like I said, Friday is our next meeting, and I'm looking forward to one of the items on the agenda is tribal relations. So Grand Portage and Fond du Lac will be there to talk about probation services, and so that's all I have to report on that.
All right, thank you. All right. So then we have our Child Care Solutions Subcommittee, Commissioner Storlie.
That was one of those days where I had 3 meetings.
At the same time.
And I did not choose childcare, so hopefully next time we'll have a report on that.
All right, well, thank you. With the Community Health Board, did you happen to attend? I know Commissioner Mills was gone, all right. We will jump down then to the Cook County Local Advisory Council for Children's and Adult Mental Health. Rana.
Well, we had a joint meeting with the, I forget the
Public
name.
Health and Human Services.
Public Health and Human Services, which was very interesting. And we do have a lot of overlap in what we do, so we mainly talked about what we're both doing. I don't know, is there anything you wanted to?
Can I just add mine in right now? Because we
Please do.
did have a joint meeting, and it was very interesting, and I think one of my suggestions is that we do it more often, because I think there's a lot of overlap. But in that meeting, we also got updates from different providers, and I'll just give you a few highlights. The important thing from Care Partners is that everyone should know they're going to sponsor a walk to end Alzheimer's in September, and they're partnering with the Hub and Edward Jones, Claire
Smith.
Thank you, Smith. And there's going to be a lot more information coming out about that, but that's the first for this county. That's going to be pretty much fun. And finally, Care Partners is fully staffed, and they're doing some strategic planning this week. So there'll probably be more information as to where they're going in the future with the initiatives that their new director is working on, Julie Wilson. We also heard from Jen Sorensen at Grand Portage, so if you know anyone who's an RN or a community health rep, they're looking for 2 positions. They have 2 vacant positions up there. And it was very interesting to hear her talk about the community gardening effort that's going on up there, both with the adults and with the children, and how they're feeding the entire population from these community gardens. That was pretty fun to hear as well. And then the last one I would say is Kate Serba talked to us. You probably heard that Dr. Farchman has left, and they're all sad about that, and so am I. Also, they hired they have a new board member, Kristen Ferrier, I think is how she says her name. And Claire Shirley stepped down, and Matthew Brown is the new chair of the board. So that's interesting things that are going on at the clinic. And that was, I think, the biggest highlights I took from our meeting. I want to thank Allison, though, and the team. I know how much work is being done at Public Health and Human Services to do all of the mandated and unmandated things that are required of them. And I just think it's very impressive the way that your organization continues to move forward. So that takes care of what we chatted about that day.
All right, great.
I'd like to
Commissioner
make a little correction. Last year, I walked to end Alzheimer's up in Grand Portage.
Oh,
So I don't know how it was advertised or anything, but I happened to be at the community center, and I took a walk with a group. There were about 12 of us, and it was a wonderful day.
and maybe that was the impetus to do it countywide. I don't know. I did not know about that. That's cool.
I can't think of her name, but anyway, it was very, I got to meet people that I'd not met before up there, so. that was good. Yeah.
Well, thanks for sharing that.
Great.
We have the Cook County Restorative Justice Committee. Commissioner Hawkins.
Let's see, at our last meeting, we, let's see, there were 14 truancy cases that they're working on. They got a deed grant for $40,000. I think that was reported when she gave her information, but I'm just writing down my notes from our last meeting. And they're looking into getting their nonprofit status. And there's no meeting in July, so won't have another update until August.
Great, thank you.
Madam Chair. Commissioner, that truancy number strikes me as kind of high, and I'm wondering, is that typical, or
Well,
do you
this
know?
is a new program.
Right.
And I guess the school has been, since the pandemic, really having a lot of truancy cases. And
Gotcha.
that's why and actually that is ages 12 and above, because this person cannot work with kids under 12 without parent permission. But that was discussed at the last meeting, that they're working on voluntarily getting those parents to work with some of these
Gotcha.
kids under 12.
Great, thanks.
So yeah, it's a huge issue, which is what restorative justice recognized and wanted to help solve
right.
the problem.
Yep, thanks.
Thank you very much. All right, we'll move on. Council on Aging.
Didn't you just ask me that?
No,
It was active living.
active living.
Oh,
I realized.
You kinda
gotta mix
Yeah,
that
I
up.
got
It's
them
okay.
mixed up, yeah.
So you can do active living now.
okay, now I'll do active living. Oh, yeah, see. Active living, they have, not a lot to report. I mean, they concluded with their grant, they had the 20 homes, and they're really hoping to be able to get washers and dryers, washers for sure, installed up there. And I just looked at the prices at the laundromat to do a load of laundry.
Yeah.
It's really expensive. So if you're already on a very fixed income, having laundry facilities in your own residence, and maybe they have to pay for them there too, I don't know, but that, I can see the allure of that and the need. So active living is, it's another group that I am just amazed, because I was unaware of the need. You know, I'm not unaware of the need of, and the substandard housing plays into it. And then it's, across this county, we've got people on the move, which is very good for all of us. So active living, it's a good group to be part of. And they're always looking for, I mean, I just think it's, we need to promote movement, and that's what they do.
All right, well, thank you. Emergency Preparedness Committee, we did not meet this month, and that meets every 2 months, so that will be coming in the future. Healthcare Planning Committee, Commissioner Storlie.
We did not meet this month either.
All right. And how about NACO?
NACO is on the move. They're going to be in Austin, Texas on Friday. They have a mid-year meeting, and obviously I'm glad I didn't sign up for it, because I would be taking a little fan with me, I think. But I did have input. These are the 4 topics that will be part of the discussion. However, it's not on Zoom, so I will wait for the review at the August meeting. But behavioral health, long-term health care, Medicaid, and the indigent care, public health, and healthy communities are the 4 big topics for the Health Steering Committee. And another couple of interesting topics that I would have gone to. One is revitalizing county health, public safety, and legal systems. which that program is going to be for 2.5 hours, so I think there's a lot to discuss on that. And the other discussion is the opioid epidemic in rural America, creating justice system pathways to care. So those would be interesting discussions, and I'm sure there'll be a good review afterwards.
All right, well, thank you. We'll look forward to hearing more about that. All right, the Northeast Minnesota Office of Job Training Programs, Commissioner Hawkins.
Yeah, our last meeting, we met in Carlton. And I'm still trying to figure out this board and my role there. And they're looking at their bylaws. There's some restructuring happening. And then I learned this last time when I'm like, okay, I'm the new here, help me. Most of those commissioners on that board were in my spot, so they were grateful that I was saying, what's going on? So, I'm the only woman on that board, and sometimes it can be intimidating when you're sitting at a table with only men and nobody's asking questions. So it's a good thing that I don't have a problem with that. Anyway, so they are re-looking at the counties that are participating. They've drafted a new memorandum of understanding. Supposedly, it has gone to our county attorney for review, so that may be coming before our board to discuss how the relationship of the counties with this group. And we're a local elected officials board, which works with the development board, which is a separate appointed board, and there's been maybe some friction is what I discovered between the two. So we as the local official board said, okay, we need more direction here. So I'm looking forward to our next meeting where we're going to sit down together and talk about the roles, and then I'm going to specifically figure out how does Cook County fit in here, because we use AEOA for job training, and Lake County uses AEOA. So I'm not quite sure why we're going to Northeast Minnesota Office of Job Training. So I need to sit down with you now that I know more. How do we fit in here, and why are we at the table? I don't know. So that's what I know so far.
Thanks for sharing the questions. I think that's really good. All right. North Shore Collaborative, I don't have an update from Commissioner Mills.
We did not meet this month. They'll
You
meet
did
on
not,
August
okay.
2nd.
All right.
I will say that the LOTS program is up and running for this summer. That's one of the initiatives of the North Shore Collaborative.
And lots means?
Learning opportunities through stories. So they have weekly book distribution, stories, family activities in Grand Portage, Grand Marais,
Birch
Grove, Silver Bay, Two Harbors.
They're doing a really nice job of publicizing that program this year, too. Everybody gets a book every week, every kid who's in the program. It's pretty cool. Their own book.
Nice.
Their own book, yeah.
Love it. Love it. All right. Well, thanks for providing that update. All right. And last but not least, the Public Health and Human Services Advisory Council.
I did
Pat,
that with Rana.
anything else you want to add?
I don't think so.
Okay.
If I may, Commissioner, one of the things that really stood out to me in that meeting was the report from Andrea Orest on all of the work that she's doing in her role as prevention coordinator under the HRSA Rural Communities Opioid Response Program grant in partnership with the University of Minnesota, Grand Portage, Sawtooth, and organizations throughout the region and community here locally. And one of the primary topics of her update was about her efforts to develop a Narcan and naloxone distribution plan, getting supplies out to providers, out to individuals in the communities. And something that was so powerful to me in that meeting is the number of people who pulled their Narcan or naloxone out of their bag and put it out on the table in the meeting, just to demonstrate how effective some of those efforts have been to bring training and access to those supplies locally, and how much more common it is for people to carry those regardless of if they're using substances.
And Cook County Higher Ed is having another training on that program coming up that I signed up for, I think, next Saturday. Yeah. And I would also add, in that meeting, we also talked a lot about mental health. when we were at the community health assessment program, everyone's talking about mental health. Mental health has become probably the highest topic of conversation in any of the meetings that I've been going through with Public Health and Human Services. So I think that's one of those things that we have to prioritize as we look at all of these organizations and their budgets, because it seems like every program is full and there are waiting lists for people to get help in the mental health area here. So that was a big issue there. Thank you for reminding me of that too.
Anything else for the good of the
Well, I
order?
was going to say that I had to go to Duluth yesterday, and because Narcan, like, I'm pretty isolated, you know, and everyone else, and I'm thinking, I could stumble upon somebody in this
Yes.
parking lot.
Yes, yes.
Well, I need some. So I just thought, wow. I mean, I never, personal, it's like, why would I use that? Well, I see, you know, there were a lot of people in parking lots yesterday, so.
It's just amazing how common it is becoming to be part of your first aid kit. It's just what you carry in your vehicle or what you have with you.
Yeah, so I'm picking some up today.
I have a question about the training. Do they also provide you to be able to buy Narcan there, or how?
You don't, you get it for free.
You
When
get it free? Oh,
yeah.
yeah. So that's part of the training. You get this thing, this.
Yeah, it's an
tube or
extra
whatever.
hour onto your first aid CPR training, and then you get those drugs when you
Two different
complete
things.
it.
One is a shot and one is a
Inhaler.
Inhaler.
So
Okay.
for people who really don't feel confident to do the shot, you could also use the inhaler, you know, as what you have with you.
Okay, so this is an individual class, or do you have to take first aid first and then progress to this, or is this an individual class?
This is added on to the first aid class.
So you have to be prepared to be there for a while to take all these classes.
Yeah, I think it's a morning.
Morning? Okay.
Yeah.
Okay.
Yeah, it's very accessible, just really a great program, and many people in our community are embracing the training. And, you know, one of the things I have thought about as on a national level, we've had it's unfortunate a football player has to have a heart attack to bring attention to the need for
Exactly.
all of us having CPR training. But as a society, we're becoming more aware of the simple things that we can do, the simple trainings we can get, medication we can provide to help our community. And I think I'm very proud that Cook County has this and that Andrea is heading this up. She's doing a great job. Other items for the good of the order? If not, we are adjourned. Thank you all very much.
Perfect.
Great time, for your next meeting.
Andrea is like a one-man show.
She's very organized and efficient and